Okay, so we're going to talk about upper respiratory infections first, and then we'll get into lower respiratory infections. This is a pretty large lecture, so we're going to break it up into a few, okay? So the upper respiratory infections, we'll talk about the infectious rhinitis, which is typically your common cold, sinusitis, laryngotracheobronchitis, which is also referred to as croup, epiglottis, influenza, which we call flu, and scarlet fever. So with the common cold or infectious rhinitis, it's a viral infection. And there's more than 200 possible causative agents for this, but the most commonly is a rhinovirus. This is spread through the respiratory droplets. So it's really important to wash your hands and be careful not to rub your nose. If you're coughing, cough into your shoulder or your sleeve, wear a mask, that type of thing. So respiratory hygiene is very important. The clinical manifestations, there's nasal congestion, there's rhinorrhea. Rhinorrhea is the watery discharge. Because the nose is very congested, people typically breathe from their mouth. There's a sore throat, headache, mild fever, and malaise. Here it's really symptomatic treatment. The problems here are the secondary bacterial infections that occur, and it's usually caused by streptococci. This is where there'll be purulent exudate, there can be systemic signs throughout the body, and a fever. So here is a primary viral infection, and we can look at either the common cold or influenza. So the virus is going to attach firmly to the respiratory mucosa. So here's a healthy respiratory mucosa. Now we have a virus that invades. You can see it sticking to the mucosal membrane. It can cause necrosis. It can cause swelling and inflammation. There you go from when you're a healthy mucosa, you have that good airflow. Now in this case, due to the inflammation, now you have congestion or poor airflow. The virus is spread along the continuous mucosa, and when it spreads through the mucosa, it can go into the ear, and now that causes an otitis media. You think of young kids really don't know how to blow their nose very well, so they don't blow out. They usually inhale or sniff inward, and it creates it deeper into the mucosal barriers. So an ear infection is called otitis media. When it gets into the sinuses, remember you have the frontal sinus, the maxillary sinus, you have the ethmoid sinus. Now you have sinusitis that builds up such pressure in the head. People can feel it when they move their head, or they're in the shower and they wash their, scrub their scalp. They can feel the movement of the fluids in their sinuses. And when it spreads to the mucosal lining of the bronchi and the lungs, that can lead to pneumonia. And that could be fatal in immunocompromised individuals. So it can spread, it can go into the nasal cavity, it can go into the frontal sinus, it can go into the ear, the oral cavity, down into the trachea, and all the way into the lungs. The bacteria sometimes, the resident flora, penetrate the damaged mucosal membranes, causing a secondary infection. And that's where you start to get that purulent exudate, okay? Sinusitis, as I said, is inflammation of the paranasal sinuses that can obstruct the drainage of the sinus into the nasal cavity. Often you feel this pressure in the sinus cavity, and it's a bacterial infection secondary to the cold. And the secondary infection could be caused by pneumococci, strep, or Haemophilus influenza. And the clinical manifestation is pain. It's pain in the face, right? Pain in the facial bones. You get nasal congestion and oftentimes fever with it. It's often diagnosed with transillumination. They use light and an x-ray or radiograph. And the treatment is typically antibiotics to treat the bacterial infection or decongestants. Now, the laryngotracheobronchitis, this is known as the croup. I had this growing up. My older son had it when he was younger. It's a common viral infection in young kids, particularly 1 or 2 years of age. I believe my son was 2 when he got it, and as he grew older, he just kind of, grew out of it. The common causative organisms here are the para-influenza viruses and adenoviruses. It begins in the upper respiratory tract and starts as an upper respiratory infection, and then it spreads to the larynx with inflammation resulting in an obstruction, resulting in what's called croup or an inspiratory stridor. It basically sounds like, and it's painful, when you breathe in or you cough, it's like the vocal cords feel like sandpaper and they're rubbing against each other. And when it creates pain and the child starts crying, it only gets worse. And then they cry and then they inhale. Every time they inhale, it sounds like this. Really, that's what it sounds like. In the morning, they'll tend to be okay. And as the day goes on, in the evening and night is when it kicks in. And we used to go back and forth with my son. Usually moisturized air is what relieves the obstruction. And for other kids, it's cold air. And you really don't know. You just have to play around with it. So, we used to run the shower in the bathtub, and we used to put some of the essential oils in there to line the GI tract, the respiratory tract, and the steam was very helpful for him. The moisturized air was helpful. I know some other children where their parents would throw them in the car, put on the jacket, roll down the windows, and just drive in the middle of the night with cold air blasting through the car. And for certain kids, that seemed to have helped. But for most, it's moist air that seems to relieve the obstruction. And you really have to watch for hypoxia. You have to watch out for any cyanosis of the lips and the fingernails because it's difficult for them to get in air. And that's where it becomes a medical emergency if they can't breathe in. So that's croup. And also with croup, the fever, there could be a fever. I remember my son ended up getting about 103.5, 104 fever. Then it got up to almost 105. And, the next morning he was brand new. So we never gave fever reducents to go from 105 to 97 or 98. We would give maybe half of the dosage just to bring the fever down a little bit to get my son comfortable. And as long as they were sleeping and they were comfortable, the body did all the magical work. Okay? All right, epiglottitis. This is an acute infection, commonly between kids between the ages of 3 and 7. This one's caused by the Haemophilus influenza type B. It's a rapid onset. There's fever, sore throat, and one of the keys to this is the child sits in a tripod position. There's drooling, there's difficulty in swallowing, and there's heightened anxiety that the child feels. There's swelling of the larynx, the supraglottal area, and the epiglottis. This can obstruct the airway. The spasms of the larynx are common if the area is touched with instruments. And the treatment here is oxygen and antimicrobial therapy. So here, if we compare, here we look at the croup, and then we look at epiglottis, and we compare the two. The croup is, anywhere from, 3 months to 3 years. The epiglottis is 3 to 7 years of age. The cause of the laryngotracheobronchitis or croup is the adenovirus or the para-influenza virus. With epiglottis, it's Haemophilus influenza. The pathology with the croup, inflammation of the mucosa and the larynx and the trachea, which can obstruct the airway. And with epiglottis, it's swelling around the epiglottis region. That too can obstruct the airway. The onset of the croup is gradual, but the epiglottis is rapid. With the epiglottis, there's drooling, there's dysphagia, high fever, and the tripod position. With the croup, it's a hoarse, barking cough. They call it inspiratory stridor, and the child becomes restless. With bronchiolitis, we'll get to that in another lecture. With influenza or the flu, it's a viral infection. It can affect the upper and the lower respiratory tract, frequently complicated by secondary infections such as a viral pneumonia. And there are three groups of influenza viruses, type A, B, and C. The one that we'll focus on is type A because it's the most prevalent. Type A undergoes frequent mutation, and this explains the reason for having to create new vaccines for the flu just about every year. And it's hit or miss. If you look at the stats, in one year they'll say it's 40% effective, the next year 60% effective, the next year it could be 20%. It's really hit or miss with this because the mutation is so frequent from season to season. The virus enters the cells in the respiratory mucosa, it replicates, and it causes inflammation and necrosis. The inflammation can involve the sinuses, the pharynx, the auditory tube. Everything just gets clogged. There's widespread necrosis. There could be secondary infections, and it's just achy all over, right? There's aching pain, there's fever, there's chills, there's marked fatigue. They can get a headache, sore throat. And the key is there's not just nasal congestion, but there's a cough, but it's unproductive. An unproductive cough means it's non-purulent, it's dry, there's no exudate. It's not a productive means you're coughing up junk and gook with it. Unproductive is just dry. And commonly there are deaths. We call them the flu epidemics. And these flu epidemics can result in pneumonia. And when it advances to pneumonia in a lot of the elderly and immunocompromised, it can result in deaths. The treatment is basically symptomatic and supportive. Unless it's a bacterial infection, then antibiotics come into play there. For the antiviral drugs, there is something called Tamiflu that can reduce the symptoms after you have it. It reduces the risk to infection of others. There are some recent manifestations that kind of concerns me, and some other doctors feel the same way. I would really research this carefully. We've seen that sometimes certain children, when they get the Tamiflu, if they've already had the flu vaccine, they get these hallucinations. It's one of the adverse reactions. You have to watch these children very, very carefully. They can act violently, their suicidal thoughts and tendency. It's very bizarre behavior. So just be very, very careful and always make a well-educated decision. Always research any treatment. Always look at any adverse reactions so that you're aware of it, so that you can recognize it or be proactive with it. And the prevention with this is respiratory hygiene. Vaccination is always recommended for most individuals. We're going to finish this lecture up with scarlet fever, and scarlet fever is caused by a group A beta hemolytic strep. The typical symptoms here in young children, you'll typically see what's referred to as a strawberry tongue. It's classical diagnostic for it. There's fever, sore throat, chills, vomiting, stomach pain, malaise, and the treatment is antibiotics. Here is the strawberry tongue. Okay, and when we return, we will be getting into the lower respiratory tract infections, where we'll talk about bronchiolitis, pneumonia, SARS, which is severe acute respiratory syndrome.